But after last year's low numbers when it came to flu cases right across the country, it seemed, you might be asking yourself, do I really need to get one? Dr. Raywat Deonandan, epidemiologist, associate professor, Faculty of Health Sciences at the University of Ottawa, joining us this evening. Good evening, Dr. Deonandan.
Hello, how are you?
I'm well. You know, I got my shot yesterday when I was at my doctor's office, and I started to think, did I really need to get it? Because as I mentioned off the top, we really didn't see many flu cases. So why should I get one?
You should get one because we didn't see many flu cases last year. Historically, a low flu year is followed by a high flu year. And frankly, since the cases last year were, not zero, but pretty small, anything we see this year will be a spike, right? Also, the circulating strain this year is the vaccine is based on what we saw last year, right? So because we didn't see much last year, the vaccine this year is a bit of an educated guess, first of all. So you may see a decreased efficacy of the vaccine this year because of that guess prospect. But also because we didn't see many cases last year, there isn't a lot of immunity this year circulating in the population. As a result, those cases that do arise might be a little more severe. It's important to be protected against it. Also, because COVID is still with us, we don't want to be a burden on the healthcare system. People do get very sick from the flu. People do get hospitalized, and many people do die of the flu. We don't want to have two parallel epidemics affecting our healthcare system at the same time.
When we do look back at last year, though, when I was seeing those low flu numbers, I thought, well, was it also a case that suddenly we have public health restrictions that we've never seen in this country when it comes to people wearing masks, social distance, making sure that they are watching what situations they're in. So I thought, maybe we just have to do that every flu season to protect ourselves against the flu. How much did that play into the low numbers?
That was almost everything, I think, in addition to restrictions on international travel, right? So how is the flu transmitted? Via droplets, so the same way that we thought COVID was. COVID has a strong aerosol component as well, though. But also the flu is transmitted via fomites. That's when you touch a surface and someone else touches that surface and they touch their face, etc. COVID, not so much. So we spent so much time with the cleaning of surfaces last year, washing our hands, that kind of thing, that helped a lot in diminishing the cases of flu and the common cold. Will we do that every year? No. We've already stopped doing that this year. In fact, we've stopped distancing for a large part this year as well. We've stopped using our masks as diligently in many parts of the country as well. So we're going to see an uptake of cases, quite likely, for the flu. And going forward in subsequent years, we'll be doing less of this every year. So I don't see the population having a stomach for extreme public health restrictions every flu year. I think the message of washing your hands and sneezing into your elbow and maybe normalizing mask wearing if you got symptoms can have legs. But other than that, we're going to see the flu being endemic again.
And today, of course, we heard Ottawa with details on the vaccine travel passport. So that does mean we're getting to that point where we are going to start to see more international travelers. So that would be a big concern as well?
Yes, not a big concern, but that's how the flu reaches us. Through travel and through products as well, because fomites are a real thing when it comes to the flu. But yeah, as the world returns to some semblance of normal, these endemic seasonal viruses will become more a part of our lives again.
We've always said, well, up until a few years ago, flu is a concern for the young and the old. But now in the last few years, it seems like everyone should be vaccinated. Why is that important?
For the same reasons everybody should be vaccinated against COVID, because you're protecting not just yourself, but the people around you. If you have an older or younger person in your life who you have contact with, then being immune to the flu will help protect them. Also, we are not indestructible. All of us have some kind of comorbidity, obesity, diabetes, whatever it might be. In Canada, more than 40% of our population has a COVID comorbidity, and that is the same as the flu as well. The flu comorbidities are kind of the same. So we're all susceptible to a strong extent. Now, how many people die of the flu every year in Canada? We don't really know. We think it's in the thousands, though. So the flu is nothing to be negligent about. It's a serious concern. And most people think they've had the flu, but frankly, if you've had the flu, you know you've had the flu. You're hit by a truck, you're out of commission for several days. It is not a bad cold. It is something entirely different.
Dr. Raywat Deonandan is my guest, epidemiologist, associate professor, faculty of health sciences at the University of Ottawa. Dr. Deonandan, I do want to get the latest, though, because parking the flu conversation and returning to our favorite conversation of COVID, but we are hearing more news when it comes to the vaccine availability for children under the age of 12. What is the latest?
Well, as I predicted, I think we're going to see Health Canada authorize this sometime in November and possibly December. And it looks like the federal government has entered an agreement with Pfizer to expedite doses of pediatric formulations of their vaccine, ready to go as soon as Health Canada says it's fine. So I think we've ordered 2.9 million doses, which should be enough for a first dose for every child who wants one in this country. That's important. Now, the doses are different in size. I think the pediatric dose is like a third the size of the adult dose, but also the formulation is slightly different too. So how the mRNA is packaged, the chemical component is slightly different. It's been tweaked to be better. So you can't just take an adult dose, take a third of it and give it to a kid. It has to be manufactured anew from the Pfizer plant. So that's where we are right now. And it looks like we're going to see widespread use of pediatric COVID vaccines at the end of this year and early next year.
I like you said, for everyone who wants one. And we know the debate we've gone through over the last number of months with the COVID vaccine for adults. We know the same conversation will be happening with parents who may be reluctant to give it to their children. What words of assurances or advice can you give to them?
I understand their reluctance. I have a small child as well. It doesn't fill me with the joy, the prospect of having to inject him with a new substance. I will say that this is always going to be a balance between risks. The risk of COVID is real. Your child will be exposed to it at some point in the next couple of years, probably, because it's so endemic. And the risk of having an adverse reaction to COVID is not large, but real. About 2%, I think, of American pediatric cases end up in hospital, which is a large number. And the adverse events associated with the vaccine are really, really small, vanishingly small, but not zero. I'm not going to downplay the risk of vaccine. It's real, but very, very small. So how do you rationalize comparing two risks, the risk of COVID versus the risk of vaccination? I'd say the tiebreaker is protecting the community. So the more children that get vaccinated, the more the community as a whole is resilient against this population. The more we can have the herd immunity conversation, which means that the crisis goes away entirely. So to me, that's what the kicker is once kids enter the immunity conversation, suddenly we can have the larger conversation about making this disease go away for the most part.
Dr. Deonandan, always appreciate your insight. Thanks for your time.
Thank you very much.
Dr. Raywat Deonandan, epidemiologist, associate professor, faculty of health sciences at the University of Ottawa, joining us this evening.